I'm here today at Bridges Audiology to talk about their partnership with Life Care Center of Hixson and evaluating your dizziness if you're losing balance. Thank you so much for coming on the show today. Good to see you.
Thanks for having us.
Thanks for having us.
Yeah. So what are the most common complaints with patients experiencing balance issues or dizziness?
Sure. So it can vary patient to patient. Some have true vertigo where the room is spinning and they feel like they're spinning. Some can just report a simple dizziness, lightheadedness, or a balance issue. So those are the most common complaints.
So talk to me about an appointment and that first consultation. What can a patient expect?
So we schedule about an hour and a half with each patient. And we do 12 different tests. And that involves looking at various parts of the ear and the brainstem to assess why people are getting dizzy and what their problem is so that we can find the appropriate treatment. So we do some electrophysiology tests where we put electrodes on their forehead and headphones in their ears, and we're doing like an auditory brainstem response or an ECOG test. But then we put goggles on, and that's called a V&G, where we're really looking at the movement of the eyes when patients are in certain positions maybe, or we actually have a rotary chair where the patient will spin around very slowly. And we're looking at their eyes for nystagmus. And when they have nystagmus, that's really what tells us if they're dizzy and what the cause is.
Right. Now, what are we trying to prevent with this type of issue? Why is this important to diagnose?
We're trying to prevent falling. For the most part. I mean, falls can be very detrimental to patients over the age of 65. And a lot of patients with balance and or dizziness are at a higher risk of falling.
Now, if they're diagnosed with this, how is it treated?
So typically, Courtney will see these patients and diagnose them, and with the partnership, she's sending them to physical therapy. Physical therapists treat vestibular dysfunction. So what I do when I see the patients is I evaluate them, and then, again, most common complaint is dizziness, balance challenges, a vertigo. So depending on what these patients are presenting with, we are treating that vestibular dysfunction. And why is that vestibular system so important? It is a strong balance system. It is an internal system that helps keep us from falling. So we may do activities where we're working on balance and we're working on firing this vestibular system better because maybe it's been sick and it's just not doing what we need it to do. We may also incorporate other balance systems besides the vestibular system, our vision, our somatosensory, what we feel when we walk, that is all incorporated with balance. And then in some circumstances, like Courtney was saying, some of these patients present with that spinning type of dizziness and a positional vertigo, and we do repositioning maneuvers to help reduce their dizziness. The goal is we are trying to reduce dizziness and reduce that risk of falling, impairing people's function, and just getting them back to doing what they want to do. These patients are so grateful, and it is so great to see a patient a couple of sessions and maybe they've been dizzy for years and they just had this underlying vertigo that was never found, and they are dizzy free.
Well, it's a very unique and rewarding job I bet you both have, especially in later years and preventing, falling, preventing maybe early onset dementia and these things. That probably what you do is really helping. How can we contact you and learn more?
You can reach out to our office. Our phone number is 423-521-3277. You can call our office, make an appointment, and we're the ones that really start out. You need to start out here with the evaluation so we can find out what the cause is, and then we would send you on to LeAnne for the treatment.
Right, and there's great parking here at St. Elmo's, so I was excited to see that. So Bridges Audiology and a partnership with Life Care Centers of Hixson. Thank you again for coming on.
Thanks for having us, Andy.
Go give them a call and learn about how you can prevent dizziness, balance issues you might be having. Enjoy those years. So thanks again for coming on.